Hi, Dr. Yass here. In this video, I want to talk about a particular symptom which, when understood, literally could differentiate whether someone telling you you need a surgery is true or false. Understanding this one differentiation in symptom can prove or refute the premise that surgery is necessary. So, what are the keys to the Yass method? Well, we're acknowledging that every tissue creates a certain set of symptoms, and the best way to understand what tissue is in distress is to understand the symptoms that are being presented by the body, which are in fact coming from the tissue in distress. So every tissue creates specific symptoms. The symptoms are created by the tissue. So we need to interpret the body's presentation of symptoms. Now, when I talk about symptoms, most people say, oh, it's the pain I have and the rating of intensity. That's not even remotely it. There's lots to understand about the pain. For instance, where does the pain begin? Where does the pain end? What brings on the pain? What makes the pain go away? And another critical separator of symptom is the pain referred or is the pain point tender? Okay. So what we're going to talk about in this video is the difference between knowing whether the pain is referred or whether it's point tender. So let's give you two examples that the schmuck system tries to coerce you into believing. So you have pain and it's 3 inches off the side in the lower back, and you're told that a herniated disc is causing that pain. So the pain is not on the spine, it's 3 inches off to the side, and yet you are found to have a herniated disc, stenosis, or a pinched nerve, and you're being told that these structural abnormalities at the spine are creating the pain 3 inches to the side of the spine. For that to be true, that would have to mean that the pain is referred. Referred. I think most people have heard this phrase, but you need to understand what it means. A referred symptom implies that where the symptom is being experienced is not where the tissue is in distress creating that symptom. The tissue in distress is somewhere else, and it is referring the symptom to the place where it is being experienced. So, as I explained, an example that you're going to be coerced into thinking is that since you're having pain and it's 3 inches off to the side of the spine, and a herniated disc, pinched nerve, or stenosis is identified at the spine, that's the cause. The only way for that to be true is that you would have to say that the symptom 3 inches off to the spine, to the side of the spine, is referred from the structural abnormalities in the spine. Another example, you're having pain in the groin area, and the schmuck doctor takes an x-ray of the hip and says, oh, you're bone on bone, you have arthritis. And since the arthritis of the bone on bone at the hip, which is on the outside of the thigh, is found at the time you're having pain in the groin, it is the cause of the groin pain. That would indicate that the pain must be referred. Referred. Since they're trying to convince you that the pain is coming from the hip joint, which is on the outside of the thigh, and the pain is being experienced in the groin area and the inside of the thigh, that would mean that the change in the structure of the hip on the outside must be referring the symptom to the groin, right? So we have referred symptoms, meaning that the cause of the symptoms is not where the symptoms are being experienced. The cause is somewhere else, and it is referring the symptom that is being experienced someplace other than the cause. The other type of symptom is called point tender pain. Point tender pain implies that if you're having pain in this location and I press on the tissue where the pain is being experienced and it increases the symptom, exacerbates the symptom, that is to say that the tissue I'm pressing on is the tissue eliciting the symptom, and that's the one that has to be treated. That's point tender. So let's look at these cases and see if our understanding of referred symptoms versus point tender symptoms helps us to understand whether the idea that I need spinal fusion for pain 3 inches off to the right or the left of my spine, or I need a hip replacement for groin pain, because that's what you're being told. And I'm giving you the actual applicable understanding how to know whether what they're telling you is right or wrong. Because as far as they're concerned, they're right, because that's what they do for a living, and that's all they're educated and trained to know. I'm telling you that with enough understanding on your own, you could make your own decision, which is what you need to be able to do. So let's go to the back. You found the herniated disc, stenosis, or pinched nerve. Let's say it's at L4, L5. And you're having symptoms 3 inches off to the right of the spine, let's say. So if I want to confirm that it's from the herniated disc, pinched nerve, or stenosis at L4, 5, where would I have to press to incite the symptom 3 inches off to the side? I'd have to press on the spine at L4, 5. And I'd have to push in, and all of a sudden the person says, oh my God, I just felt that shoot to 3 inches off to the right side. Well, if you're having pain 3 inches off to the right side of your spine, go find out what level of the structural abnormality you're being told is the cause and press on the spine as hard as you want. Try. See if you can incite the symptom to shoot to the side. And it's not going to happen because there's no possible way that stenosis at L4, 5 or herniated disc or pinched nerve can create pain there, because the nerve root that comes out of L4, 5 actually innervates the area in the inner shin. Just look up a dermatonal chart and you'll see that nerve root innervates the inner shin. It doesn't innervate the skin 3 inches to the right of the spine. So you press on the spine, nothing happens. Now you lay down, have someone on your stomach, and have someone press 3 inches off to the right of the spine where you think you're having your pain, and let them push in hard and see if they incite your pain. You go through the roof from what they're pressing on, and you'll find out, yep, you're going to have increased pain. That palpation test, that palpation means touching, confirms that the symptom you're experiencing 3 inches to the right of your spine is coming from a tissue that exists 3 inches to the right of your spine. And shockingly, that's where the QL, quadratus lumborum, the lower back muscle, exists and attached to the top of the pelvis. So by pressing on the spine and not referring the symptom, and then pressing 3 inches to the right of the spine and bringing on the symptom, you have just confirmed without hesitation that the symptom is coming from a strained QL. Wrap your head around this concept. You got a schmuck with an MRI trying to convince you to get spinal fusion on one side, and then you, through the understanding of the difference between point tender pain and referred pain, have confirmed irrefutably that the pain is point tender, therefore it can't be coming from the spine, and therefore it's coming from the muscle. What part of that do you think still gets you to think that you should get surgery? You just proved it wasn't from the spine. It's clearly the tissue you're pressing on 3 inches to the right, so it's your lower back muscle. Oh, that's right. That lower back muscle in spasm wouldn't show up on an MRI anyway. So if in fact that is the cause and you were looking at an MRI, you weren't going to find it there anyway. So why are you even looking at an MRI? You see the insanity of this? You see how if you go through the cycle of understanding, it's insanity. It's lunacy. But what's not lunacy is the body's presentation of symptoms. That is exactly what it should be in a way of trying to create awareness of what the tissue is that's creating the symptoms that are being experienced. Okay, so that's the back. Let's go to the hip example. So you're being told you're magically bone on bone because they took an x-ray, which can prove that you're bone on bone anyway. The eye cannot see if you had a 32nd of an inch of joint space or zero. The eye can't see it. So the idea that someone looks at that and says you're bone on bone is just, again, lunacy. It's made up. It doesn't mean anything. So let's go to the idea. If it's coming from the hip joint, which they're trying to tell you, the pain in the groin is coming from the, lay on the opposite side, have someone jam the thigh bone into the socket of the joint and see if you could cause that symptom to shoot to the groin. You spend all day doing this, it's never going to happen. Now, go into the groin, have someone try to press where your pain is and see if they can incite the pain. Make it worse, really get aggressive, right? And if they press on a tissue and you could say, oh, yeah, that's it, that's the pain, you just proved your pain is point tender. And therefore, the tissue that's being pressed on is the tissue that's creating the symptom. The tissue in distress eliciting the symptom of pain in the groin you're experiencing. That would most likely be a muscle called the sartorius muscle, right? And if you notice that you had decreased weight bearing capacity, you were limping, things like that, all of those are other contributing signs to indicate you have a muscular deficit. That, in fact, the hip joint has nothing to do with the cause of your pain. Whatever they found is just an incidental finding, requires no treatment, shouldn't even be discussed. But again, what you notice here, you got a schmuck with a picture, and he's interpreting or she's interpreting the picture with her eye, trying to justify that you're bone on bone, and you know for sure they're not capable of seeing that simply by the naked eye. So that in itself tells you to listen to that is lunacy. And then you just corroborated by doing the referred test versus point tender test that the pain is not referred, therefore it can't be coming from the hip, that in fact it's point tender, and therefore the tissue you're pressing on in the groin is the tissue eliciting the symptom, which happens to be the sartorius muscle. Combined with other corroborating symptoms, it's confirmed. So I want you to think about what you just heard and tell me how important is the differentiation of pain as to whether it is referred or point tender in your ability to determine whether what you're being told and what has been identified on diagnostic testing is in fact the tissue in distress eliciting your symptoms, or is it possible it's muscle? It's the answer. Now, remember, all that diagnostic testing crap, that's just images. What your symptoms are, that's real. That's what the body's creating. So the idea of listening to diagnostic test findings and people talking about diagnostic test findings versus the ability to interpret the symptoms is psychotic, insanity. I understand it is the system, and they want it to stay like this forever. But my job is to educate you, to make you aware that there are actual legitimate ways of interpreting your symptoms that they have no part. Because remember, symptom understanding, the interpretation is not part of the existing system. Those are principles of the body, how the body works. Those were created by Hippocrates. The use of the MRI and X-ray to identify the cause of pain are principles of an institution, of a system, an organization. That falls outside the principles of the body. The very ones that were created by Hippocrates. The Yass method follows the principles of the body, right? The understanding of whether the pain is point tender or referred, that's an attempt to interpret symptoms. By the way, the word symptoms was invented and created by Hippocrates himself, right? There was no question that there was a recognition that to understand disease or organs that are in distress, you needed to interpret symptoms. So this is really heavy stuff, because I want you to understand that although I'm outside the existing medical model, and you could find hundreds of thousands of people implementing the existing medical model, that doesn't make it real. What needs to be understood and what needs to be followed what are principles of laws that have been established for years and are theoretically correct, not what are principles of an institution that were implemented 40 years ago. And by the way, prior to the X-ray and MRI, they were using the interpretation of the body's presentation of symptoms. If you go back to Marcus Welby from the 1960s and 70s, go watch that show, and they showed Marcus Welby in the doctor's office. He's asking the patient about what their symptoms are, where they're feeling it, all that kind of stuff. That's what disappeared when they decided to implement the use of X-ray and MRI to supplant the understanding that you need to interpret the body's presentation of symptoms. The Yass method has never gone away from it. Almost 30 years now. There's no question that that is the path and leads to the highest level of accuracy in identifying the tissue in distress. In more than 98% of cases, it turns out it's muscle, which, again, these muscular causes, 98% of the cases, it's muscle. Those muscular causes never show up on MRIs. So just wrap your head around just how much misdiagnosis is going on. So, all right, that's what this video is about for you. I hope you like it. I hope it's making sense. You're learning. You're getting empowered. You're getting to understand what you need to understand to get the right diagnosis and recognize that in most cases it's muscle, and who's going to fix you? Only you can make yourself strong enough until the force output of your muscles is greater than the force requirements of your activities, which is where you are when you are pain-free and fully functional. So if you want to get in touch with me, you could do so by email at drmitch@mitchellyass.com. It'll be in the description below. If you want to make a Yass method Zoom session, this is your best way to get the Yass method. You don't have to necessarily come to Jacksonville, Florida. I've been doing these for years internationally. You go on the website, livewithoutpains.com/sessions, and you can schedule a Zoom session time and day that's most comfortable for you, the day and time that works best for you. And that's it. We do the evaluation. We get the treatment. If it's confirmed to be muscle, the sessions are videotaped. So you have that going forward. We make sure everything is being done correctly. You get a 4-week follow-up session just to make sure you're on your path. And before you know it, you are pain-free and fully functional. It's hard to say and tough to accept, but it is the reality. The Yass method is the only existing true method to diagnose and treat the cause of pain and of the symptoms. So please take it upon yourself to get the method, get pain-free, and live the life you so justly deserve. By the way, if you like this video, give it a thumbs up. If you like my YouTube channel, Dr. Mitchell Yass, please subscribe to get notifications when new videos are added. For now, this is Dr. Mitchell Yass, wishing you a pain-free, fully functional life. Bye-bye for now.